Many people believe cotton swabs clean the ear canal, but in reality, they often do the opposite. Instead of pulling wax out, the cotton tip pushes it further inside, and that's where the problem begins. When wax is pushed deeper, it becomes compacted. This can lead to earwax impaction. You may feel fullness in the ear, reduced hearing, or even a ringing sound. Over time, the blockage becomes harder and more difficult to remove. The skin inside your ear canal is very delicate. Cotton swabs can cause tiny scratches. These small injuries allow bacteria to enter, which may lead to pain, swelling, and infection. If inserted too deeply, a cotton swab can even damage the eardrum. This may cause sudden pain, bleeding, dizziness, or temporary hearing loss. In severe cases, medical treatment becomes necessary. The truth is, your ears are self-cleaning. Jaw movements like chewing help move wax outward naturally. If you feel blockage, use doctor-recommended ear drops or consult an ENT specialist.